Perhaps after everything we heard today about the NHS, the group which says we need to rethink our expectations or funding or both has a point. That group is the NHS providers, which includes hospitals and ambulance services. But really, in the end, the more alarming assessment came from doctors running 68 of England's accident and emergency departments. They wrote to the Prime Minister to say patients are dying because their staff are too busy to treat them. And if the rhetoric is not convincing enough, the figures do tell their own story. Last month, 85.1% of patients in England were seen within 4 hours. That's well below the 95% target and, in fact, equal to the worst level since it was introduced. That means just over 300,000 patients waited for more than 4 hours. And last week alone, 16,600 patients waited more than half an hour in an ambulance before they even got into A&E.
The sign says it all. If you go to Northumbria's emergency hospital, you will wait for treatment for 3 to 4 hours. And this is a quiet day. One of the best hospitals in the country, and yet, over December, it still missed the government's target for how long people should wait for emergency care.
It's starting to fill up now as the ambulances arrive, and our rooms are full of patients who are already being assessed or waiting to be moved into beds on the wards.
This is the lead A&E consultant at Northumbria's hospital. Her department's waiting times are better than average, but it is still a daily battle.
It's non-stop. It means that patients that come into hospital with less significant illnesses, they're not critically unwell, may have to wait. But it's just been non-stop. We've had a lot of people with flu, or more than we have done before, and a lot of people with norovirus than we have before, and they have different requirements, so they all need to have individual rooms and be isolated, and the sort of numbers we've had have put significant pressures on the beds that we have available.
Do you think you're coping?
I think we're coping. I think we're under a lot of stress and a lot of pressure.
Today, 68 of Joe Hughes's peers, heads of A&E departments from around England and Wales, spoke out. In a letter to the Prime Minister, they warned of patients managed in corridors, some dying prematurely, waiting an average of 10 to 12 hours to be transferred to a bed, with over 50 patients at a time waiting for beds and some sleeping in clinics as makeshift wards.
And is your chest pain gone away now?
No, I've still got chest pains at the moment. If I have 2 heart attacks, you get a bit worried and everything.
Oh no, it's absolutely the right thing to do to come down.
This man will be seen by the specialist quickly. It's how this hospital performs so well. But even so, they struggle with the numbers appearing at the front door.
4 of about 10 of your patients here are already in A&E for longer than 4 hours.
And around about this time is just become a bit of a bottleneck in ED. So any patient who has been over 4 hours, for example, that patient there, will ensure that they have access to hot food, they'll have a proper hospital bed rather than a trolley, or they'll at least be offered it if they want it. And they then become the priority to get them a bed on one of the wards.
Even though this is a good hospital, patients are still waiting longer than the 4-hour target. Northumbria's A&E lead nurse has never seen anything like it.
One of my students has just said to us, Craig, yesterday, it felt like 3 days, didn't it? In all the years I've worked on emergency departments, this has been the busiest.
Today, more voices adding to the call for a new tax to boost the NHS. Little comfort for those arriving at hospital right now. Allegra Stratton, News at 10, Northumberland.
And Allegra is here now. Look, I think for a lot of people watching this, it feels like a pretty unprecedented crisis. That's certainly what the doctors are saying it is. But in one sense, in terms of money, if the occupants of number 10 and number 11 Downing Street don't accept that, then not much is going to change. What's your sense of their thinking at this point?
Indeed, it would appear they don't accept it. Theresa May's had a couple of occasions in the last few days to say she gets it, but she refuses to. She thinks that it's had the money, the NHS has had the money it needs. She had that in the Commons yesterday at PMQs. And to be fair to them, at the last budget in the last few weeks, it was the NHS that got the biggest boost. It got quite a lot of money, nowhere near what it needs, but it did get the money. The problem in particular is that you have a Chancellor in Philip Hammond who particularly doesn't like it when a department says it needs even more money. He doesn't like to be seen to give in. That's just the type of Chancellor he is. So it would appear there'll be no movement.
OK, and yet we've seen today Tory MPs talking again, and not for the first time, but in greater numbers, about the idea of a different special tax for the NHS? A runner or not, do you think?
I do now think it is. It's a cacophony of voices calling, and it's for different sorts of people. Today, a former Tory minister, but it's also former Treasury permanent secretaries, former cabinet minister Oliver Letwin a while back, even Nick Timothy, who has advised Theresa May, saying it does now need more money. I know that the Health Secretary himself wants the funding to be boosted to German and French levels. There will have to be some movement at some point. The question is when. This year is the 70th anniversary of the NHS. I think that the pressure will become intolerable at some point in the next 12 months. In the summer, Jeremy Hunt comes forward with a social care white paper. It just has to point to a funding crisis. So I think at some point in the next 12 months, we certainly can't go through another winter crisis like this, can we? Because there's too many A&E doctors, GPs, all of that ilk saying they can't cope.
OK, well, thank you very much indeed. Let's see.